So this is a really great question. What is the you want medications versus a daily practice to address the symptoms. So we are sick, mentally addicted, especially Dr. Gill and Nam were like, it's a lot of work of recovery. Why not take a pill? Antidepressants, antipsychotics, anti-anxiety medications, lots of stuff exists, and it's not bad. None of it's bad. The simple way to answer this question is something we call it a dose. We call them in medicine therapeutic index. So every medication has a window in which it's helpful, but if the dose goes up too high, it's not helpful. If the dose is too low, it's not helpful. So medications, so we have efficacy and dose. I think everyone can understand that when you have effective medication, if the dose is too low, does the medication do anything? No. So the curve starts down here, right? 0 dose, no effect. And then you start taking the increased dose, and does it stay effective, or do you start, or is there a dose maximum?
Does your body get used to it and have to take more?
Yeah, there's all sorts of things, right? So the reality is that as the higher the dose, most medications follow this thing called an S-curve. Initially it's effective. At a certain dose, the effect levels off. Let's say it's methadone or Suboxone or an antidepressant. You're occupying neurotransmitter receptors in your brain. The higher the dose, at some point all those transmitters are going to be occupied. There's no more transmitters, so you can take, that's why Suboxone, you can't take more than 32 milligrams. After 32 milligrams, you could take 64 milligrams, 100 milligrams, and it's no different than 32. And 32 is really not that different than 24. Most countries have 24 as the dose maximum for Suboxone. The point is, there's a limit. The higher the dose, there's a limit to the efficacy, but then actually if you keep increasing the dose, you get the side effects. And if you keep increasing the dose, you die. Because it has a heart, any medication in excess is a poison. So if you take too much aspirin, everyone knows aspirin's good for the heart, right? It turns out it's not true across the board, but it is generally good for the heart if you've had a heart attack, for sure. If you take too much aspirin, it fries your kidneys. It'll destroy your kidneys. So some aspirin, low dose aspirin is good. Too much aspirin, fry your kidneys, and then you die. That's medication. Antidepressants, they can numb out the feelings, and if you're at a really low point and not eating and your weight has gone down 30 pounds and you're just really, really tired, then it makes sense to go on an antidepressant, mirtazapine or something, to sort of bring your appetite back so that you can start eating, because if you're not eating, your brain's not working. So that makes sense. If you're too depressed to get up off the bed to go see a doctor or someone, antidepressants can be helpful. In addiction, antidepressants have been shown really not to help that much. They don't help too much, especially if you're drinking, you're binging alcohol all the time. Who the heck knows what's happening in your brain, but it's probably not a good level. So this is medication. All medications follow this dose effect. So it's kind of like good for a bit and then not so good. A daily practice. Now, this is really dependent. I'll draw this in maybe green. A daily practice. So connect to self, connect to others, commit to daily practice. Definitely, you will not feel much of an effect for a while. That's why people don't do it. It's like, I take this pill, it makes me feel this good. Why? The thing about a daily practice is the more you do it, it has a different dose-response curve. It has what we call an exponential dose-response curve. This is a max-min. We have a teacher here. I'm sure you have better at teaching these things, but this is a max-min curve. So there's a maximum efficacy and then it goes down. A daily practice, the more you do it, the more effective it gets. And actually, it doesn't have a maximum. It doesn't have a maximum. The more you do it, the greater the effect, and at some point, if you do it long enough, it's actually more than the medication was doing for you. What people usually do is if they're on a medication and they start building a daily practice, at some point they start having side effects of the medication, or the medication blocks their practice, and then they come down off the medication. And that's okay. That's fine. But there's no medication that's going to help you with your traumas, in another day we'll talk about opening blood vessels in your brain, but there's no amount of a medication that's going to deal with your problems. A daily practice will deal with your problems. It'll help you access the happiness of life. I think what in AA they say, life on life's terms. It's good to accept life on life's terms, as things are. It increases your ability to forgive yourself, to forgive others, to have compassion for self, to have compassion for others. None of these things medication does. Medication allows you to survive. But there's a big difference between survival and living. If you want to survive, that's good. But let's not confuse survival and living. Very, very different. Honestly, sadly, most people in society, the ones who are quote-unquote normal, the ones who aren't here, functioning, are surviving. They're miserable. But they never went to jail, they never went to a hospital, they never ended up homeless, they never ended up with severe emotional distress, suicidality, psych ward. They didn't do any of that. That doesn't make them healthy or normal. Actually, normal maybe, because normal is a statistical definition. Healthy, definitely not. The only way to health is a daily practice. Medications help you survive, and sometimes that's what you need to do. But that's not all you need to do. Most people who go on medications after 5-10 years have to change because their brain gets used to it. And then the cycle and the cycle and the cycle, and then if that's their only way of coping in life, in later years it's very hard for them. Because the brain has adapted and has developed some imbalances. And so, at NAM, we're big fans of building a daily practice and of cultivating and developing it. Great question. Thank you.